Welcome to Health Systems CIO's interview with Mari Savickis, VP for Public Policy at CHIME. I'm Anthony Guerra, founder and editor-in-chief. Mari, thanks for joining me.
Thanks, Anthony, for having me.
Excellent, Mari. A little bit about your role. Everyone who's listening to this should know about CHIME. Maybe one or two don't, but maybe there's new people who don't know about CHIME. So quick 30-second overview of CHIME and then a little bit about your role.
Okay, sure. First of all, we're not Chime the Bank. We
Yep.
sometimes get that. I mean, often misunderstood. We are the College of Healthcare Information Management Executives, and we represent those in the highest levels of their organization who purchase and deploy technology and who care for patients.
All right. Awesome. And your role a little bit. I know you
Yes,
have
I am Vice President of Public Policy, and I head up government affairs for Chime.
Okay, yeah, it's a huge part of what you guys do over there at Chime, as it should be. So very good. All right, I've got my sort of topics that I think are active on the policy front, but I'm going to open it up to you a little bit open-ended. Couple of top things on your mind that you guys are looking at and following for the members.
Oh, yes. I mean, the list is long, not gonna
Mm-hmm.
lie.
Mm-hmm.
So I made a list so I wouldn't forget anything and checked
Okay.
it twice, Anthony. So there's so much going on here.
All
Just
right.
so one of the biggest things that we're doing is helping our members navigate the rapid pace of change. So our members are pretty good with, a lot of things that come out of the government. However, it's the uncertainty that is often like the snag. And so there's a lot of uncertainty right now. And so we're helping them navigate that by making sense of the changes and what's going on and just basically doing like a daily landscape analysis for them. So that's one big thing. The other thing is just taking stock of what's going on at the agencies and department. When I say department, I mean the U.S. Department of Health and Human Services, though we also track other departments, but most of our bread and butter is inside of HHS. So we're looking at, like, say, Senate confirmations, like the number two at HHS has not yet been fully confirmed. We're looking at what's happening with the FDA and like where they're going to go with AI guidance, which we're not sure yet. There's also like I call the 10 for 1 rule, which is President Trump's efforts to deregulate. And those are just like some of the high level things. We're
Mm-hmm.
obviously on the congressional side looking at the big, beautiful bill, right? The big, beautiful bill, reconciliation process, right? Because there's a big Medicaid component. And while we are not really a Medicaid shop here, we tend to focus more on Medicare. We are deeply aware, based upon conversations with our members, about the impact of cuts to Medicaid. So we're tracking that, right? And then
Mm-hmm.
in my periphery, my side view is really just the impact of tariffs, right? Because of the purchasing and there's gonna be things that are purchased outside the country that hospitals need to continue doing business. So that has a cost impact as well. So those are some of the big things. And then if you do a little bit of a deeper dive, I think we're looking at really the budget, right? What's the budget going to look like? What's the FY26 appropriation process going to look like? And so for those of you who are total policy nerds and wonks and you just, are trolling the trade press, you may know that in early May, the administration released their skinny budget. That's a name. I didn't make that up. That's like a government term. So skinny budget is really like the blueprint for what the Trump administration plans to achieve with FY26. And then the true real budget with like all the nuts and bolts will come out in the next few weeks. So we're paying attention to that. And that's moving in tandem with the reconciliation process, which is totally separate. So we're looking at that. We're also looking at how they're restructuring the government. In our case, we're looking closely at HHS and to watch and see, what's going to happen with ASTP, right? I think that that's a big question mark. There were some documents that were leaked to the media that indicated maybe a new Office of Technology. So that's not the official name, but something with Office of Technology or Chief Technology Officer. And so, would ASTP get folded into that? Would they be moved into CMS? Like, there's all these questions, right, that we're just trying to I guess iron out that it's still not clear where we're going to land. And
Mm-hmm.
so I think that we'll know in the next several weeks once the budget comes out for FY26, which it's not a fait accompli. And in previous years, this is more like treated like a blueprint, right? It's more like aspirational, but because the Republicans are in charge of both chambers of Congress and the White House, there's, it's less entirely aspirational, though I'm sure some pieces will not make it over the finish line. But those are the kinds of things that we're paying attention to because it will have an impact on our work. And I guess I'll end by saying this, that, I mean, we're tracking a lot of things, but it's hard to know exactly where the government's going until they put some of these people into place, right? So until some of the political appointees are put into place,
Mm-hmm.
and then really start to allow the staff to be able to have meaningful conversations, because they're not really able to right now.
Mm-hmm.
So that's been a little bit on pause, and I know we're going to get into some of the deeper things like what we're tracking, but at a very high level, those are some of the items.
All right, perfect. Yeah, so I'll just touch on some of the other things, and then you can tell me if you have updates in these areas. You mentioned the FDA, and I believe there was some stuff going on with medical devices around the FDA and cybersecurity. They were trying to um, improve that, make that whole process a little better. Do you have any update on what the FDA is doing around medical devices and cybersecurity? Any thoughts on that?
I mean, yes and no. There's the Patch Act, right?
Mm-hmm.
So the Patch Act was passed, like, I think, like, way to draw on my memory bank here, Anthony. Really appreciate that. But the Patch Act has more requirements on medical device manufacturers. Okay,
Mm-hmm.
that's a law. The Patch Act is, it's codified. It's in statute. Now, how that gets executed in reality is, I think, another story. I mean, the FDA has been downsized. Some people got rehired. It's a little bit confusing, right? Who's
Mm-hmm.
where, who's on first. So, another thing that I didn't mention at a high level, just to kind of go back for a moment, then I'll bring it back,
Yeah.
is, if you're cutting the government, which the by all indications, they're looking to make like a 20% cut across the board. If you have fewer staff, right? So that means conceivably, and I think definitely from some other overtures the administration has made, less oversight, right? So
Mm-hmm.
then when it comes to overseeing Patch, I think that's a question mark. So the other thing too worth mentioning is that the FDA is driven by guidance documents. Many of our members have complained for years. If you read, say, for example, anything with medical devices or cybersecurity guidance, it says it's something like guidance non-binding, because it's not a regulation. So I think that there's going to be a lot of things that are to be determined, to be determined. And this is period and era of uncertainty that we're trying
Mm-hmm.
to navigate. So I don't have a lot of answers for you, but I think that because of the heavily driven approach that the FDA has taken around guidance, that's something we'll be paying attention to. Does it mean that they're all going to get ripped up? No, but we're getting now into space where it's maybe not in statute. The Patch Act is statute, but there are other pieces that may not be clearly in statute. In fact, on Mari's fun to-do list, Anthony, you'll appreciate this, is go back and read the 21st Century Cures Act. There's a lot of stuff in there on software as a medical device. So it's a long way of me saying that we don't have certainty right now.
Yeah, and that's fine. I think what's useful to the people that'll listen to this is, and this would be how my mind works. What do I need to worry about? Like, or what's important that's happening? And as far as the upshot of what you're saying is not much going to be going on around medical device security. So don't worry about it. Like it is what it is
Well,
right now.
I mean, I would say continue doing what you're doing to secure your environment.
Right.
Our
Sure.
biggest issue, and always here, like every single day, is cybersecurity. So nobody, no matter what the government's rules are or policies, you don't want to, you don't want to suffer a destructive cyber incident. I don't think there's any provider out there who's like, what, today's the day I want to suffer a terrible cyber incident. Said no, CIO ever, right? Or CISO ever. It's just so hard on the business. So
Hmm.
we'll just keep doing what you're doing to improve your cyber posture.
Yeah. Yep. Yep. Okay, so let's telehealth flexibility or reimbursement, 6 month extension if I'm not incorrect, which is takes you around September,
Yeah, it's
somewhere
about
around there,
six
right?
months.
So, what's going to happen? They're going to redo it another 6 months. They're going to extend it 2 years, or they're not going to extend it. Any thoughts there?
It's expensive, Anthony. Costs a lot of money. I'm not
Mm.
saying it's going to go away. I just, Mari being Mari, I'm an optimistic person by nature, but I'm also a realist. So even though we're going to continue to advocate for, number one, a full repeal of the pandemic era, or the pre-pandemic era policies, right? The one,
Mm-hmm.
and during the pandemic, they like loosened everything up. The stuff that
Right.
we have in place right now, temporarily, we'll
Right.
continue to advocate for a full-blown solution that is like, there's no time delineation. In the absence of that, we'll advocate for 2 years, right? But what's more realistic, I mean, this is me, I just think because of the cost, and you can see what's going on with Congress, they're fighting over every red cent. It becomes harder and harder. And so this reminds me of, for those doctors out there listening, there might be a few of you, the sustainable growth rate, the SGR, the doctor fix, where they kick the can down the road year after year after year, because it's just so costly, right? So it's not part of budget reconciliation. It could be part of the CR, the continuing resolution in September. I, you know, one could hope, I don't know, I don't want to be negative. I think it's going to continue. Let's put it that way. That's the positive side. It's going to
Right.
continue. It's just that the length of time is to be determined.
Yeah, because that one is certainly a big deal,
It
right?
is, and
Because
we just
that,
supported the Connect Act, which was reintroduced again. And so we've been a supporter of that, which would be a full-blown solution. It's just that I think cost is the biggest barrier.
yeah, but as I said, it's got real like implications because there's people, organizations, health systems will have service lines that have to shut down, right? If those aren't extended, the things they're doing now that they can get
Yes,
reimbursed for, they will no longer be able to
yes,
continue. So that one has like immediate, direct, specific impact and can impact
yeah,
investments you've made or are planning to make in your
yeah.
sort of remote care programs and all that,
Yeah,
right?
it's so let's just try to be positive, okay?
Okay, I'm with you.
So just do your happy dance and just your telehealth dance, right?
Yeah, I
Pray to
love it.
all gods that we're gonna get this.
All right, good. Let's talk about the HIPAA security revision rule, which I think came out under the Biden administration, and I've heard that maybe dead on arrival. It's not going anywhere. Nothing to worry about. So Chime came out and said we're not big fans of this. We don't like it. It's too much. Too many requirements. It's too much. Uh, feel free to correct me anywhere in there. But is that dead, or is that still could
It's
happen?
still alive, everyone.
Okay. Okay.
So the answer is no, it's not been fully rescinded is
Okay.
the proper word. So it hasn't been fully rescinded. Now, that's another thing. We have not done a victory lap. Okay. Not I might like out in my backyard being like, yes, we won this one. No, I have not done that yet. So it is still out there. And right now I think what's happening, and again, I could be proven wrong, but there's other things that are kind of like in the queue that are more important, right? So you try to get people like named to the administration, like while they're moving really fast, there's only so much you can do in one fell swoop. And
Mm-hmm.
so I like to think that they haven't gotten to this yet, but let's just say all indications from a deregulatory standpoint point to this being a total overreach. And from everything our members have said to us, and we don't often come out and say, we can't do this, but in this case, this one was so seismic. The amount of documentation was enough to strangle any provider. It was just so much documentation. And we have summaries on our website if anyone really wants to get into the nuts and bolts of it. Again, it's a proposed rule, everyone, it's not final. And there's just pieces that just seem like really, really unworkable. The two sections that come to mind for me would be encryption and multi-factor. I would go take a look at those. Our read of it is suggests rip and replace a lot of your medical devices, and that would not even be possible even if there were enough medical devices to go around to be ripped and replaced, the cost alone would be cost prohibitive. So I'm just mentioning a few things. We're hopeful that it will be rescinded, and we continue to highlight these concerns for the Congress and the administration. So no, to answer your question, it is not it has not been rescinded yet.
Do you remember when you were reading that, like in real time and saying, "Oh my God, like this is
Anthony,
crazy."
I like to say I'm older-ish, and there's a lot of things I do and don't remember, but you know what I do remember? I remember working at CMS when, yes, I worked at CMS when this rule, which was initially owned by CMS before it went to OCR, I remember working, on the security rule. That's how long ago. So that was like my first, I was like, wow, this is like 20 years ago. And when I did read it, and I did read it line for line, I was like, whoa, this is a lot of document every little thing that you've done. And I think what we would say if we had the opportunity to meet with the administration is is that, is this really achieving the intended objective of, I mean, ideally it would be to secure to have a more secure environment. And I don't think that death by 1,000, paper cuts is really going to achieve the intended outcome. So I think we would ask them to take a look at it and see like what can we do differently that would make it more reasonable and still improve the posture of the healthcare sector. And there's some stuff that's come out of the Health Sector Coordinating Council saying like, let's just try this
Yeah.
again. So there's a lot of things that we've already laid a lot of groundwork, but this isn't the rule that we think would be really, really hard to achieve.
Yeah, I remember the HSCC, they came out with their document that said basically, hey, why don't we start over and you come talk to us first?
Yeah, and we're all, I mean, we have members, hundreds of members, and my team and I, Chime is very involved in the Health Sector Coordinating Council Cybersecurity Working Group. It's a volunteer-led effort, and it's not just providers, it's multi-stakeholder. Like we've worked on this really, really hard for years now, so we feel like we do have skin in the game. We just don't think that this is the way to, I would call it, even beyond skating to the puck. It's just too much documentation. It's too much. And I think that maybe it was a missed opportunity, perhaps, to really try and maybe take a few bites of the apple instead of trying to, eat the whole thing. So I don't know. We're hopeful that maybe they'll take another look at it and we can start over.
All right, perfect. Rural. Let's talk about what's going on with the rural hospitals. A lot around cyber that's come out.
Yeah.
Um, we did a couple articles on a few reports. Rural providers warn of cybersecurity crisis amid funding and workforce gaps and lacking basic cyber defenses. Rural hospitals drawing the attention of bad actors. That was a Microsoft report. The other report was, I think, ECRI. Was that ECRI? That was no HSCC. Um, yeah. So, a couple of reports coming out. Rural health systems, lots of concerns, lots of worry, resource issues. Anything going on with helping them out?
Yeah, rural, I call them the smalls. That's
Hmm.
sort of our colloquial term is the smalls. They struggle mightily and they continue to struggle mightily. And I think that we've got a lot of pressure on providers in general speaking, but when you talk about rural, you're talking about an amplified situation where maybe there's things um, like mergers and acquisitions or workforce shortages. They don't have the budget that they need to make the kinds of deep investments in cybersecurity that are warranted. It's a very, very challenging environment. It was challenging last year. It's challenging this year, and so those are going to continue to be providers who are just going to have a really hard time. And so they're when we talk again to policymakers, we're always sure to mention the challenges that rural providers face in particular, and the smalls, other providers too that are maybe not be rural, but they also are significantly disadvantaged. I think there's some sensitivity to the rule, but I'm also, we also see that there's some changes with CISA going on. You probably are tracking that as well. There looks like they're going to be getting a cut. Again, the skinny budget seems to suggest that, though they're maybe being reoriented more towards cyber. It's like still a little bit fuzzy in terms of what's going to happen there. But this is a real challenging area. So we continue to look for ways when we talk to policymakers. We understand there's no like magic pot of gold at the end of the rainbow, right? There's just so it's not there. So we're trying to figure out what other policy they call them like levers here in Washington. What other kind of like things that they can push that would allow without making like major investments. Like one thing that comes to mind for example, would be, which I don't think this is like a full-blown solution, but just like one example is the Stark and Anna kickback. A lot of people don't know that you can actually receive donated technology, both hardware and software, certain hardware and software. That the thing is, it's been underutilized and there's reasons for that. So that's just one idea. So we're looking at different ways to try to approach this. I mean, some of it might be taking off, even just taking off of their plate some other regulatory burdens might at least like ease things a little bit. There's no full-blown solution for this. They need resources. I mean, if it was an ideal world, like having a rec center like they did for EHRs where you could have somebody like help train them on how to do things, or maybe it's like donation of some like licenses. There's a lot that goes into this. It's a big problem.
Yeah, and I think it was one of those reports that they don't even money won't even do it. Like that was feedback from from the providers that, yeah, we need more than money. Like we need people, we need help. We don't just need money. Which
That's
was kind of
exactly right. It's
interesting.
not just financial. They might not have people in their area who, though you can
Right.
do some remote stuff, but there's just generally a cyber workforce shortage anyway, but their ability to pay them is much less than say, a large integrated delivery system. And if you're working remote, who you're going to work for, the large integrated delivery system or the small rural provider?
Yeah.
They often wear multiple hats, right? There's just so many issues.
Yeah. And it's very interesting because you don't want to have a situation where people can't get care in a reasonable geographical proximity to where they live. If you're in a rural area, farm type situation, um, you as a country, you don't want to have where they all shut down and there's nowhere to get health care in 500 miles, right? So you get
No, we,
into,
we don't want
yeah,
that. And
yeah,
we're also, we're reopening, we released a set of AI principles last year and we're working on updating them again. And one thing that just keeps coming up is, you don't want to have a situation where you have the haves and have nots, right? With rurals,
hmm,
goes beyond cybersecurity, but
yeah,
in order to access some of the technology, you really need to have high speed internet.
mm,
Right? And
yeah.
so AI doesn't run on like a windmill. It just doesn't. I that it does, but I don't think it does. So we need high-speed internet. So there's just kind of basic things here. So if you don't have access to the best AI tools, which can be in some cases one that helps improve your cyber posture, you're
Yeah.
sort of creating this digital, we're widening an existing digital divide. And so we want to make sure that policymakers know that it's important to invest in rural.
That's such a great point because AI can be a difference maker and an equalizer. It can be almost like added workforce, right? It can do amazing things for you.
It can if you can
But
afford it, right? I mean, that's and you need to have the internet to run it on.
right,
And in some cases too, like we're looking at, we hear from our members, AI and cyber, that this is a whole other like worlds colliding, but there are ways to use AI to improve your cyber posture, but if you can afford it, right?
yeah.
If
And
you have
that's
internet.
it's almost like you set me up there for the next one of the next issues, which is AI. There have been a couple of reports that come out about deep fakes and phishing,
Yeah.
um, and how AI is supercharging the bad guys, but of course, it also has the potential to supercharge the good guys. So, to your point, if you're a rural and you don't have broadband or you don't have the infrastructure needed to leverage AI, that means the bad guys have it and you don't, and that's really not what you want. So it
Not
all
good.
kind of, right? A lot of this comes together and weaves together. So any thoughts around um, that cybersecurity and AI?
I mean, you pretty much summed it up as
Yeah.
it can be used for good and it can also be used for evil. The cyber criminals are becoming more and more sophisticated. And I'll just say the conversations we were having with our members last year is so different from the conversations we're having this year. They're more sophisticated. Our members are more sophisticated, have like, really a lot more experience, but still it's still challenging. And one of the issues that keeps coming up is the help desk impersonations, which you've probably heard. And there's probably some other, I'm trying to remember what was the other thing, but the help desk impersonations are such a problem when you're
Mm-hmm.
trying to, so you're using social engineering to call into the help desk to have allegedly a staff person's or clinician's credentials reset. You need the password. And so you wouldn't imagine some of the stuff that has been able to get through. We did a webinar on this and we had a recording. We weren't able to record the webinar, but we had the live recording played during the webinar of the actual attack, and it was almost successful. They almost were able to divert major money away from this provider. Thankfully, the amazing cyber team was able to stop it, but it was a close call. And what we were told is like the help desk is supposed to be helpful. You're like a little too helpful, right? So because
Right.
they're so sophisticated, so
Yeah.
some of our members now, it's literally like a proof of life situation, Anthony. I'm not kidding you. It's like get your CEO on video with you. It's not enough just to hold up I don't know, maybe a driver's license. Like they really want to have multiple ways to screen to make sure that you truly are who you say you are. And so that's becoming more prevalent. but it's like you have to try to stay one step ahead of the criminals, and they're just getting more and more sophisticated with the use of AI. It's pretty wild, like voice impersonations, right?
Yeah.
They
Yeah.
can impersonate you and do a whole separate Anthony,
Right.
Guerrero with a J podcast,
Yeah.
and it would sound like you. It's amazing.
Yeah. I mean, in my personal life now, I get an email about anything. This account's been compromised. Reset this. Delete. Delete.
Oh,
Delete.
so
I don't
crazy.
even any. So if anything came in that was real, I would have deleted it and
You
whatever.
delete it because right. So
I
don't
don't
click
care.
on anything at
Don't
all.
click. Don't respond. Don't
Yeah.
just delete everything. Everything that says
The
you have to
FedEx
reset
parcel
this.
is not being texted to you
No, it's
about.
not.
It's just
Forget it.
not.
This account's been compromised. This parcel's here.
Yeah,
This
it's so
delivery. Delete.
scary.
Delete. Delete. Delete.
Delete, delete, delete. And they're really they're pretty sneaky. And yeah, so AI is making their ability. Here's the other thing too. I forgot about this. They're able, since some of the criminals are not from America and their English is maybe not perfect, they're able to make the English appear more perfect. So it looks like it actually came from within the United States.
Oh
So they're
yeah,
able, because a lot of
100%.
times you'll see an email, like we were just talking about our text, but there's like a lot of typos in it, or the punctuation
Yeah,
is off, and you're kind of like, that seems so weird. But they
that's a
can
thing of the
clean that up with
past.
AI and make it
Oh,
look,
that's
yeah, really,
absolutely
really deceptive.
the comical, the borderline comical email. That's a thing of the past. You're not going to get that
Right, so
anymore.
so they've cleaned up the English
Yep.
language, the punctuation is looking good, it's looking squared away. Oh, we just need finance to sign off on this. Just click, we need you to, please, it's really urgent. Click on this, link to the invoice. We just need to get this off our desk. The CEO authorized it.
Yeah.
Oh boy.
Well, yeah. And I was in some session where they talked about the elements of indicating something's up, and that sense of urgency is always going to be there. It's always going to be you got to do this now. There's always going to be that sense of hurry up.
Yeah. So I mean, on the flip side, that means that the providers have access to tools that now can help improve their cyber posture,
Hmm.
leveraging AI. So we're starting to see them take up those tools. And so that's being helpful also on the other side of things.
All right, very good. Issue that I know is near and dear to Chime's heart, patient identifier. I believe, did I see you post recently? It said, if you think this is a niche issue, think again. Wasn't that you? Wasn't that one of your
Yeah, that
posts?
was me. That was really just supporting. So Cassie Leonard, Cassie Leonard, that's her maiden name. Oh my gosh. Cassie Ballard is our director of congressional, and she led our piece because we're a founding member of the Patient ID Now Coalition. She led our participation in a congressional briefing recently. And so I was reposting some of that stuff. And as someone who has twins, like when they come out, they don't just like automatically pop up with a name. It's like baby A and baby B.
Uh-huh.
You know that's good,
Right.
and it's attached to the mother's record. You can see all kinds of problems happening. But yeah, patient identification is still, we think, like the linchpin for interoperability, right, for patient safety. And so, and we believe that there's a big cost savings in here, including for the
Hmm.
government. There's, right, I personally believe that there's 50 states, right? And so that means 50 Medicaid files. And when you start marrying up Medicaid files or with Medicare, which becomes dual eligibles, that they're using different standards. And so it's a mishmash of data. So I believe that there's savings in here, just waiting for someone to find those savings and look at them. But we have a two-pronged approach on this. We continue to, beat the drum as hard as we can, removing Section 510, which you're like, what is Section 510? It's basically the longstanding ban that prohibits HHS from investing in anything related to a patient identification standard. So that's been in
Hmm.
place for more than 20 years. Okay, so we try to get that removed. It's been an uphill battle. We've had some small wins here and there, but not overall. We haven't won the war. And then the other thing is the Match It Act, which creates standards for patient matching. So that was reintroduced, and that is great. So we're big proponents of that. And it may even be sponsored on the Senate soon, potentially by Senator Warner. We're looking at that, but Representatives Kelly and Foster are the leads on the House side, and they've been our champions for a really long time. And this is so important. So if you are interested in taking a look at this bill, reach out to us. we're happy to share our enthusiasm around the Match It Act.
Love it. Love it. All right. Interoperability, anything going on that the folks at home should know about? We're
Yeah.
still in a situation where um, we can't just, we don't have a giant app store and we can just plug stuff in. Yeah, I think Epic's got that, but in terms of being on one EHR and being able to plug in all kinds of stuff, I mean, I don't think we're still where the industry would love for us to be. Anything going on there?
Um, yes, there was a recent RFI. So I think that they're again like rooting around in things, and I do think that they're feeling things out. There's the health tech ecosystem RFI, which just came out, and they're asking, whether TEFCA is working, right? So TEFCA is voluntary, everyone. It's still voluntary, it's voluntary in the statute. But it's not entirely clear where this administration is going to move on TAFCA. I think it's probably going to stay. I think they want to do something with TAFCA. Precisely what that is remains to be determined. So more on that to follow, and we are following that closely. But they're sniffing around on this with the RFI,
Hmm.
and so I do think it's going to continue to see the light of day. And again, I could be proven wrong, but the fact that they're asking about it, because why would you ask about it if you don't care about it? Usually you ask about things in RFIs that you care about. So I think that that's an indication that they want to keep Tafka. What was the other thing too? There's an RFI, the health technology ecosystem RFI, which I think I just mentioned, but then there's also an RFI within the IPPS, which is the Medicare acute hospital rule, right? Inside there's an RFI. And so I think we'll be using this opportunity to further some of the priorities we've talked about that, patient identification does, that is like the linchpin to interoperability. So there are pieces in here because what can you, okay, you have all these records, but you have a lot of mismatched patients. Like
Hmm.
there isn't really a true patient identification solution inside of the TAFCA. And so I think that there's some room for improvement. You asked about apps. They're talking about apps in this RFI. So we'll be looking at that some more around patients and their use of real-time data, right, with apps and being able to embrace like wellness and health more. So we're still digging into that. So I think, interoperability still on the table. I think that the plans around interoperability have not yet fully been revealed by this administration. And I think that we're going to see more. IPPS was probably in many cases, I think a lot like very baked. It was very baked because it comes out so soon. It comes out in April, which is only like really 3 months into barely like 3 months into the new administration. And it's a payment rule, so it has to go out the door. These other things like a health tech ecosystem RFI is more ad hoc. And
Hmm.
so the White House is rooting around on getting ideas. And I think that they have a lot of ideas. And I think that they're probably being informed by a lot of different stakeholders. So I think there's more to follow on the interoperability pieces. And I think real-time data is going to have a front seat to a lot of this.
Excellent. All right. Well, we're almost out of time, but before I let you go, let's have a little fun. Let's have a.
Finally, Anthony, first you invite me on to talk only policy.
I promised you I would get to it. Okay, so you want me to start? You want me to ask the question, or you want to ask me the question first?
Can I start? Is it
You
okay?
may. You may.
Okay, we're going off script,
We're
everyone.
going off script. This is brand new
Brand new.
material.
We're blazing
Yeah,
new, and it's not
yeah.
technology related.
No.
Anthony, tell me, is there a gift that someone has given you recently that really just brings you a lot of joy and happiness?
Now, I don't recall getting any specific gifts, but I think if I understand what you're getting at, I can relate an item that I've started to use in the home. So my son, a few months ago, my 15-year-old, wanted a ice cream maker. Okay.
Oh,
So, but he said he was gonna pay for it. He's like, order me this on Amazon, take the money
all
out of my
right.
account. So it's
All
an
right.
ice cream maker. So it's been sitting on the counter for a couple months, and he makes ice cream once in a while. And I've been looking at this thing, and then I saw someone on X say, "Oh, have you made your own ice cream? It's amazing." And I'm thinking, I got this thing on my counter. So I've started to use it to make ice cream, trying to make healthier ice cream, and I'm getting into it. I'm having a lot of fun. So there you go,
Okay,
ice
so
cream
are we gonna
maker.
post your favorite recipe?
We can think about it.
We
We
can
can
think
think
about it.
about
Will
it.
you at
Maybe,
least tell me
yeah.
the flavor?
Yeah, it's sort of a vanilla type thing. It's got, vanilla extract in it, and things like that. So it's got what else? A couple blueberries, um, fat-free milk, and what else am I putting in there? Cinnamon, that kind of stuff.
Tasty.
Yeah.
Taste. So is it the foodie one?
No, the machine is a Ninja. It's
Ninja.
a
Okay, Ninja.
Ninja. Yeah.
I heard really good things about this.
Yeah, yeah. So
I love ice cream. Who doesn't like ice cream?
it's pretty cool. I would suggest you check into it if this sounds
I
appealing.
mean, I may. I mean,
All
I'm
right.
sort of like, I don't know. I was like, oh, do I need another appliance? But I love that you're making ice cream. I
It's
think I
very
need a
cool.
recipe.
All right. Well, now you got
Mhm.
to return the favor and tell me what is a gift that you received that is giving you great joy.
Well, so as I was getting ready for our show, which I like completely prep everyone, make sure I know everything that Anthony's going to ask me. I was making myself fresh pot of coffee. I really like coffee, and I have I guess it's like a milk frother.
Mm-hmm.
I use almond milk or nut pods, and
Yeah.
it honestly makes the top of your coffee amazing. And I absolutely love it. My best friend gave it to me a few years ago. Again, it's another kitchen appliance. So,
Right.
but I
Right.
mean, it makes you feel like you're drinking your bougie coffee at home.
Yeah.
Love it.
I was at Starbucks the other day and I was looking at them with this tool, and I know them pretty well there because I go there quite a bit. And I'm like, what is that thing? And they said it's a milk frother.
Yes. I mean, I
Yeah.
don't think they're very expensive, but I
No.
use it all the time, like every day, and it makes me feel happy. So thank you for sharing
Yeah.
that
You're
you are making ice cream.
you're welcome. But to follow on a little bit is this idea of overwhelming your kitchen with appliances. I was interested in possibly getting a bread maker, and my wife vetoed it. She's like, "We don't have room. It's too big.
Yeah.
Can't take one more thing in this kitchen."
I have an indoor grill, but I keep it in a closet. And so I only take it out. But I do understand your wife's concern. If I buy the bread maker first, I'll do a full-blown review for you. And then maybe you can have me back on the show and then we can talk about bread.
Yes, I would love it. So, Mari, that was awesome. I enjoyed our little fun ending there. Thank you
Mhm.
very much. I appreciate it. I think the readers will love it, and I hope I can reach out to you down the road again. So, thank you so much.
Yeah, thanks, Anthony, for having me back. I appreciate it.
You got it. Have a great day.
You too. Bye-bye.
Bye.